Practice test, Unit 5, Children and Women in Sports. Which type of motor development takes place in skeleton of the body? A. Gross motor development. B. Fine motor development. C. High motor development. D. Small motor development. A. Gross motor development. The first stage of motor development in a child is A. Early childhood. B. Infanthood. C. Adolescence. D. Adulthood. B. Infanthood. Fine motor development uses blank muscles for carrying out blank activities. A. Smaller, posture and balance maintenance. B. Larger, posture and balance maintenance. C. Larger, precise. D. Smaller, precise. D. Smaller, precise. Which of the following is not a factor influencing motor development of a child? A. Sensory integration. B. Muscle tone. C. Confidence. D. Endurance. C. Confidence. Which of the following factors are responsible for motor development? A. Genetic factors. B. Environmental factor. C. Food and nutrition. D. All of the above. D. All of the above. Ball handling is an activity starts in a child in a development stage called blank. A. Infanthood. B. Early childhood. C. Middle childhood. D. Late childhood. B. Early childhood. Exercises to develop movement skills like jumping, hopping, throwing, and catching is prescribed for a child in A. Infanthood. B. Early childhood. D. Adolescence. D. All of this. B. Early childhood. Which of the following exercise will be most appropriate for an 11 years old child? A. Twisting. B. Cycling. D. Pulling. D. Playing high-intensity outdoor games. B. Cycling. The inclusion of physical activities in lifestyle will lead to A. Growth and development of a child. B. Correction of postural deformities. D. Development of cognitive abilities. D. All of the above. D. All of the above. Sensory motor development of a child is dependent upon blank. A. Environment. B. Endurance. C. Nutrition. D. Sensory impairment. C. Nutrition. It is the ability of a child to maintain the exertion required for an activity. A. Strength. B. Flexibility. C. Stamina. D. Endurance. D. Endurance. Abnormal curve of the spine at the front is called A. Scoliosis. B. Kyphosis. D. Lordosis. D. Psoriasis. C. Lordosis. In which kind of deformity the gap between ankles goes on increasing of an individual faces difficulty during walking and running? A. Bowleg. B. Knock knee. C. Flat foot. D. Scoliosis. B. Knock knee. The reverse of knock knee position is known as A. Kyphosis, B. Scoliosis, C. Bow leg, D. Lordosis. C. Bow leg. In which of the following deformities there is a wide gap between the knees? A. Flat foot, B. Lordosis, C. Bow leg, D. Kyphosis. C. Bow leg. Which sports person won bronze medal in weightlifting at the 2000 Sydney Olympics? A. Swapna Barman, B. Karna Maleshwari, C. Geeta Phogat, D. PV Sindhu. B. Karna Maleshwari. Which of the statement given below is incorrect regarding the methods to increase women's participation in sports? A. They should be provided with good technical instruction. B. Parents and teachers should motivate the girls to take part in physical activities. C. Coach education programs should be organized which inform the ethical and interpersonal issues of sexual harassment. D. None of the above. D. None of the above. Which of the following factors are responsible for less participation of women in sports? A. Lack of sports infrastructure. B. Social constraint. C. Concern for personal safety. D. All of the above. D. All of the above. What are the corrective measures for scoliosis? A. Perform Trikonasana. B. Lie down in prone position. C. Walk on heels. D. Both A and B. D. Both A and B. Which of the following method will be appropriate for increasing the participation of women in sports? A. Development of community sports infrastructure. B. Development of changing infrastructure. C. Reducing the participation fee for women in sports institute. D. All of the above. D. All of the above.